Can scoliosis be treated in seniors? Unfortunately, scoliosis affects all ages, including seniors. While scoliosis is most commonly diagnosed in children, it also affects adults of all ages. The most prevalent form of scoliosis diagnosis is adolescent idiopathic scoliosis, and this is typically diagnosed between the ages of 10 and 18. However, many cases of adolescent idiopathic scoliosis never gets diagnosed, and they'll get diagnosed in the adult form. There are different types of scoliosis, but the most common type is idiopathic scoliosis, and this is considered to be 80% of all cases of scoliosis. The remaining 20% of cases are associated with known causes. Neuromuscular scoliosis is when you have a neuromuscular condition and you develop scoliosis. Congenital scoliosis is when you're born with scoliosis and there's an abnormal vertebra in the spine that happens in utero, and you're actually born with scoliosis in the infantile years. It's diagnosed. And degenerative scoliosis is a result of some type of degeneration that's occurring. It's normally diagnosed in later stage life, which we'll talk about in a second. Now, when we look at the types of scoliosis, the most common is idiopathic scoliosis, which is by far the most prevalent type. And normally the second most common type is degenerative scoliosis. Now, the adults get idiopathic scoliosis typically by not finding it in an adolescent form. It goes undiagnosed, and therefore the curve never progressed to anything significant enough where it was actually diagnosed, or maybe it was diagnosed after it never progressed during their pubescent growth spurt, so they're never checked by their pediatrician, or never developed a significant symptom or postural misalignment, and they go undiagnosed, and then they find it in the adult form because they normally feeling some kind of pain or discomfort. And this is by far the most common type of diagnosis that occurs in the adult form. Now, we know scoliosis doesn't become a compressive condition until skeletal maturity. So most kids, as they're growing and developing, never feel any kind of pain. So the only symptom of the scoliosis is what you can see. But if the curve doesn't become big enough to see anything, therefore they go undiagnosed. And then as the curve progresses in the adult form as a result of gravity over time, this progression can lead to now pain, and this pain can lead to the diagnosis because it's compressing. Even though in the adult form, it can progress very, very slowly and very little. So the amount of pain somebody feels in the adult form of scoliosis is not relative to the size of curve in general. It's relative to how much you progress in the adult form that can lead to pain and discomfort. And very oftenly, it's low back pain, it's mid back pain, it can be pain radiating into your arms or legs, it can be numbness, it can be tingling, it can be fatigue, it can be weakness. Now, what ends up happening is the pain starts off very mild in younger adult life between 20 and 40, and normally the pain is very mild and achy, and most patients kind of get by. They'll go to chiropractors to get adjustments, they'll get massages, they'll do stretching, they'll stay active and do exercises. But somewhere 40 to 50 years of age, because the curve is compressing as a result of gravity over time, this pain starts to increase and starts causing more discomfort and no more issues. And somewhere around 50 plus years of age, it escalates to a point where what they were doing no longer has an effect. And now they start looking for more answers, and that's typically when I kind of get a phone call in terms of what can we do to try to help a person with this progressive adult scoliosis. Now, adult patients can also develop degenerative scoliosis, and this is by the second most common type of scoliosis in the adult form, but by far the largest is adolescent scoliosis, undiagnosed or either diagnosed and progressing in the adult form, and they've had some kind of pain. The degenerative scoliosis is they did not have scoliosis in the adolescent form, and what they're having is the spine is degenerating abnormally in a certain area. Now, very often doctors will say, though, this is because of natural age-related degeneration, and I would challenge that, because if that was the case, every person that would age would develop scoliosis, and we know that's not true. What ends up happening is something happens in younger adult life that causes a small shift. What could be this happen? Typically, it's some kind of trauma or injury that doesn't cause a massive amount of scoliosis, but a small misalignment in that area. And that misalignment remains uncorrected. And just like an unaligned car, that tire that's misaligned, that has more weight on it, would degenerate faster than the other three. What the same thing happens to the spine. That bone that's out of alignment will degenerate faster than the other parts of the spine, and this abnormal excessive degeneration in that area will cause this degeneration to happen abnormally and asymmetrically, and can lead to a curve. Most commonly, this is diagnosed somewhere in the 50 years of age or so in women, somewhere around 60 years old in men, and because this needs time for the spine to degenerate abnormally, and somewhere around menopause is where we tend to see it, and this is a result of bone density issues, maybe hormones related, we don't really know, now, but there can be an excessive amount of progression in this age, and this amount of degeneration can start causing pain and malfunction, and it can start causing things that they feel, and then they get an x-ray and they find they have degenerative scoliosis. We also know lifestyle can affect the amount of degeneration, like sedentary lifestyle, chronic poor posture, alcohol, smoking, those types of things, repetitive ergonomic issues like not lifting properly, lifting things incorrectly can lead to these things. But most cases, this degeneration occurred much earlier in life and it's been progressing, and you're dealing with the effects later on in life. When we see degeneration of the spine, we see affected discs, we affect the muscles, it affects the tissues, it affects the nerves. And a lot of times, a lot of surgeons say, oh, you have a degenerated disc, and they'll do disc surgeries for these patients, and the spine still remains in the scoliotic position, and normally their symptoms and problems go unresolved. So when we look at this degenerative type of scoliosis that's progressing in later stage life, or we see idiopathic scoliosis that's been progressing in the middle adult life and starts rapidly progressing in older stage life, we know regardless of the type, whether it be degenerative or idiopathic, dealing with the curve size is what's important, because as patients' curves get bigger and they get older, they start progressing faster and they start causing more issues. And as they get older and bigger, treatment becomes harder and harder. And in some cases, it can be very hard to treat. In addition, as these curves get bigger and as the patient gets older, now even surgical options can no longer be available, because a lot of times the surgery can have such a negative effect on the person and on the body that the person can't even qualify for a surgical intervention at this point because of their age and other health conditions that could be associated in that age group. So we definitely recommend, if you have scoliosis and you know there's a misalignment and you feel like it's worsening, that you definitely treat it, because if you treat it sooner, you're more likely not to deal with the effects later on in life. So if you're 60, you're better off treating it at 60 than 70. 70, you're better off treating it at 70 than 80. You're always better off treating it sooner. And in fact, as the curve progresses in later stage life, it can be very debilitating. It can affect quality of life. It can affect movement. It can affect the ability to get up and walk. It can affect your stand up and kind of go kind of time. So we know degenerative scoliosis and adolescent scoliosis progressing in the adult stage can lead to lots of pain and increased spinal disability. So we recommend treating it. We use very specific types of chiropractic care. We use different types of tractions, different types of therapies, exercises, rehabilitation. We even use scoliosis bracing on a structural level to try to make the spine, first of all, stop from worsening, but also to restore the shape and make the spine straighter. Now, when we treat seniors, we definitely use all the things I mentioned: chiropractic care, exercise, therapy, traction, vibration, bracing, but we use them unique to that person, meaning not all seniors can perform the exact same treatments at the same level. So we may modify the treatment, may modify the dose, we may modify, but the goals are still the same. Our goals are still trying to reduce the scoliosis on a structural level, so therefore we can stop progression and try to restore as much function as possible. The key to successful treatment in a senior is, number one, the senior being able to tolerate the treatment, and two, trying to reduce the size of curve to therefore stop the progressive nature of scoliosis. In later stage life, curves can start progressing very rapidly again. They can start progressing 5, 10, or 15 degrees a year, and that's what we're trying to stop, because if curves progress in that amount of progression at that stage of life, it typically leads to significant discomfort and pain. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.